Hi, my name is Grayson Schroyer from Avanade, and today we're going to take a look at our Microsoft-based Patient 360 solution for healthcare. For today's demonstration, I'm going to be playing the role of Joe. Joe is a care manager who is responsible for maintaining relationships with patients and managing their conditions, as well as ACO participants. Day to day, I look at things like care plan adherence, patient trends, ACO participation and results. We also need to identify our outliers and non-compliant patients and address their needs proactively. We're also going to take a look at some patient outcomes. A typical day in my life includes patients being seen and diagnosed by specialist physicians. This information is entered into the EMR and then flows into our tool. Using our native workflow capabilities, a new care management collaboration session and care plan are created. All of the folks that are involved in caring for this patient are alerted and prompted to have a collaboration session to discuss the best course of action for this specific patient. Once we've decided on the best course of action, we configure the care plan to automate the outreach for phone calls, appointment reminders, and text messages, as well as integrate with wearable and take-home devices such as Fitbits, e-glucometers, and blood pressure cuffs. This information is reported by the patient and flows back into the system to create alerts to care managers when patients are not complying with their care plan. Let me show you how to do this. This is my Care Manager dashboard. This is where I can manage all of my active care plans and patients. This list is critical care alerts, which represent patients that have not adhered to the care plan or to the care regimen. I also have a list of all of my active care plans by care plan type and patient. This shows me a representation of all my patients by diagnosis and all of the activities associated with these various patients. All of these graphs are completely interactive and allow me to segment my patients by diagnosis. I can click on this piece of the pie and see all of the heart disease patients and very easily select these folks to send a direct message to if we've made an update to their care plan. Now, let's take a look at a patient 360-degree profile for Adrian Thomas. This view provides a comprehensive 360-degree profile of our patient Adrian Thomas. We can see where she lives, her most recent medical history, and her most recent customer service cases where she's called in with questions about benefits or her care plan. We also have encounter information coming over from our EMR where we can see that Adrian came in for a diabetes consult that resulted in the diagnosis of diabetes. We can house assessments in the system and make them actionable with our workflow tool. And we have all of the active care plans for Adrian. Let's go ahead and take a look at the diabetes type 2 care plan for Adrian Thomas. I've pre-populated the care plan for today's demonstration, but as you can see, we have a variety of conditions that we can manage with our module. For today's purposes, we're going to stick to diabetes. After we've chosen the care plan type and set the duration, the next step in the process is to collaborate with the physicians that are involved in caring for this patient and figure out the best course of action. Utilizing the native Skype for Business and Link integration, we can start a real-time call with these folks to figure out the best course of action and then configure it within the tool. Based on the care plan type, only diabetes-specific activities are enabled on the right-hand side. In this case, we want to track A1C for Adrian Thomas, and as soon as we check the box, we're prompted to input our guidelines, our patient goals, our most recent values, and any other detail related to managing A1C. The next step in the process is to configure our outreach strategy, which can include items like educational campaigns for diabetes or integration with devices in the patient's home, such as e-glucometers. In this use case, we are asking for daily glucose readings, and any reading above 100 is going to trigger an alert for the care manager. Additionally, we have a graph of all of the glucose readings that Adrian has sent back to our system, as well as a list of all upcoming appointments, reminders, and text messages that we've sent to Adrian, all in one place. Thanks for listening. This has been a very high-level overview of our comprehensive patient relationship management solution we'd like to discuss with you. If you give us 2 hours, we'll transform the way you think about managing relationship with your patients. If you'd like to learn more, please contact Jeff Hall at the information below. Thank you.